Welcome back to Stop Feeling Like Shit. And I'm your host, Daniela Korth. And finally, Dr. Buzz decided to show up. I
I'm
mean,
back.
he's
I'm
been
back.
absent for a couple of weeks, right?
I've been busy.
Okay, well, we're glad to have you back.
At least that's my story.
Yeah. Okay, so on today's podcast, we're diving into biologics. And trust me, the space is evolving fast. And you've probably heard some buzzwords before like allograft, Wharton jelly, stem cells, exosomes. And now we have something even sexier, muse cells. Muse cells. But what are biologics really? And what do they actually do inside the body? And how are they sourced, the processed? And how do we separate the real science from the marketing hype? Because we know that's out there. And so we're going to break it down for you with Dr. Buzz, and he's going to tell us all about it. All right, so let's get started.
All right. So I want to start off, but there's two different categories. We'll call these orthobiologics. And basically, these are agents to help your body heal. And what a lot of people have to understand is I always tell patients, if you're alive, you have the ability to heal. So, but as we get older, we don't heal as quickly as when we were younger because we have less stem cells, less platelets. Like we just become less healthy with age. And there's lots of other factors too. So these orthobiologics are tools that we can use to help people heal like they're young again. And
Mm-hmm.
there's two different categories. You have autologous, which basically these are products that we make out of a person's own blood.
Mm-hmm.
And then you're going to have allografts, which are donated tissue, usually human birth tissue. So those are the two different categories. So we'll start with autologous first, which is which you make derived from a person's blood. And the two main things you're going to hear a lot of is platelet-rich plasma or PRP, and then there's another product called A2M, which is alpha-2 macroglobulin, and they're both made from blood, but they're both totally different products. We'll start with PRP because that's probably the most common. It's been around the longest. And basically, what PRP is, or platelet-rich plasma, is we take a person's blood and we capture it. And we basically, what we're trying to capture is the platelets because the platelets have lots of growth factors. Probably the simple way to think of that, think of it as really good fertilizer. So you take a person's blood and you spin it down and you capture these platelets, which act as fertilizer, and then you put them to an area that's not healing, and it can help that area heal better. Just like if you have a garden and you want to grow more tomatoes, for example, if you put fertilizer, you get more tomatoes. PRP functions very similar in the body. You take these platelets, you focus and concentrate them and put them into an area, and it helps that area heal better. Now, that space has evolved a lot over time because there's single spin PRP and then there's double spin PRP. And unfortunately, most providers are still using the old fashioned single spin PRP. If you're not sure, basically the easiest way you would know if you've had a PRP procedure, did your physician draw 1 or 2 tubes of blood or did they pull 10 or 15 tubes of blood? Because PRP, there's only so many platelets per ml of blood. So if you only pull 10 or 20 mLs of blood, the PRP is not going to be that strong and it's not going to be that concentrated. I always explain to providers, it's kind of like making orange juice. If we're going to make a glass of orange juice, if you take one orange and squeeze it and add water to it, it's orange juice. But what if I do the same glass and put 10 oranges in it and just a little bit of water? Obviously, they're both orange juice, but the one with the more oranges is going to be better or more concentrated.
Right.
And what the research has shown is really to get a strong anabolic effect, you need to be between 9 and 12 billion platelets. You can only get there if you're pooling at least 60 mLs of blood, which is more blood than a typical PRP. So that's where double spin is a much better process. And the other thing we do here at Buckeye and a lot of clinics we work with is any of these things that you're injected in is in liquid form, you have to put it into a scaffolding because if you just inject liquid into a joint, into a torn muscle or rotator cuff or wherever you're putting it, the liquid dissipates in a few hours to maybe a day. But what we're able to do now with some new technologies is we can take some of the leftover blood and change it into what we call scaffolding, which is like a gel. And then we mix that gel we make from the blood with the PRP with the blood and inject that gel. And that will last in the area for several months.
Mm-hmm.
So it's much more effective if you're getting a PRP or any of these procedures we're going to talk about today, if your physician's using scaffolding with it, because it's more of a time release and that'll prevent you from having multiple procedures and you're just going to get a much better effect.
Yep.
So the secondary product I want to talk about is A2M, which is alpha-2 macroglobulin, and that's just a protein. It's a protein that's produced by your liver But what's unique about this protein, and another thing that's kind of cool about it, is A2M is actually the largest circulating protein in your venous system. So it's a very large protein. As we get older and you potentially develop arthritis, either due to overuse, post surgery, whatever, all arthritis is caused by the same thing. And really the mechanism is when you have a trauma to a joint, say you had a meniscus surgery or you ran a lot or something like that, your body, when you have pain in the area, says, hey, there's a problem. So what your body, and basically the way your body, that pain warns you, don't keep using it. So your body releases these other proteins called cytokines, which signal your body to cause pain. So pain's there for a reason. It's kind of like your check engine light, don't use it. That's why taking pain medications is bad. That's like putting duct tape over the check engine light.
Mm-hmm.
But the secondary thing the body produces is the body's like, there's pain there must be damage. It releases these other proteins called proteases into the joint. And these proteases are like little Pac-Men or termites, and they go to the area to clean up the damage. The issue, though, is as we become older, and we'll say 30 plus, your joints become avascular. Those proteases or proteins that were released for a good reason into the joint get trapped in there. And when they're trapped in there over time, they're like little termites in there, they start to eat away at the joint, and that's the cause of arthritis.
Yep.
And anyone who has arthritis, that's what you have in your joint. You have a bunch of proteases. So, and putting PRP in there, putting a steroid injection in there, stem cells, whatever you do, nothing gets rid of proteases. That's why if you don't do A2M first for arthritis, the arthritis will always come back. What's unique about A2M, though, is A2M is a broad-based protease inhibitor. It's in your blood. So what we do is we take your blood and we spin it down and we capture that A2M protein because it's too large to get in the joint otherwise. And we put it into a needle and then we inject that into the area where you have the arthritis, and it literally stops the arthritis at the molecular level. And that is the only treatment that does this. There's no other treatment out there available that will literally stop arthritis at the molecular level. So if someone has arthritis, the first line of defense is always do A2M first to get rid of the cause of the arthritis. And then if you want the tissue to grow back quicker afterwards, then you start thinking about fertilizers such as like a double spin PRP.
Or
Some of
stem
the
cells.
allografts we'll talk about
Yeah.
next.
Yeah. So you can probably, based off Dr. Buzz just talking, he's repeated himself a lot about this because we do educate doctors about this all the time because a lot of people have arthritis these days, right? And a lot of people want to save their knees. They want to save their hips. They don't want to get surgery. So I think that what happens with people is that they think that there's no other option out there. Like they have to get their knee replaced, they have to get a hip replaced. And so if people are listening to this, it's like maybe they're thinking like, I've had surgery or, I have pain in my knees or I was told by my doctor it's bone on bone. So if that's them, you need an MRI, right?
X-ray or MRI, it depends on the joint. I would usually say shoulders and hips, I like to have an MRI. Knees, you really don't need an MRI. But I can't tell you the hundreds of people we had come through Buckeye that they've been to their doctor and they'll say they have bone on bone. You have to have a knee replacement. And that's not the case.
Right.
Now, obviously, I tell people if the bone's gone, like if you have like an avascular necrosis of the hip and the hip ball joint's gone, you can't grow back a bone. Or and the same thing in the knee. If the cartilage is gone, we get great results. But if the bones are actually deteriorated too and the condyles are gone, then you've waited too long.
Yep.
But just because the cartilage is gone, if you do A2M, some peptides, and some allografts afterwards, we've had amazing results. And you do have to keep in mind, always get a second opinion, because if you're talking to someone who only does surgery and doesn't do regenerative medicine, they don't understand the space. It'd be like coming to me and asking dental advice. I'm not a dentist. I don't know. So, get a second opinion from someone who specializes in regenerative medicine to make sure, number one, a good doctor we only accept patients we know we can help. So if you've gone too far, we'll just say, hey, listen, unfortunately, you've waited too long. You have to have surgery. But if we think we can help you, we'll give you that option. And because at the end of the day, you're always better off keeping what God gave you and not trying to replace it with metal, plastic, or titanium, if you can.
Yeah, I agree. All right. So let's talk about, obviously you're using A2M for arthritis. Could they put that anywhere else besides the joint?
A2M is, remember, these proteases get trapped in joint capsules, so it only works inside a joint capsule. So if you had like a tendonitis, A bursitis, you would not use A2M. But for joint capsules, it's the gold standard for arthritis.
Okay. Perfect. All right. So now let's talk about, we talked about PRP a little bit, double spin PRP. That's what we primarily use in the clinic, just because you're getting all those platelets. And what are
Yeah, I
we,
mean, if you look at the research, the largest study ever done on PRP, they use single spin PRP, and what they came up with that study is it's no better than placebo. So knowing what we know now, if you're
Mhm.
not using double spin PRP, it's just not going to be effective.
Yeah,
And like I said, unfortunately, I talked to probably
we talk to
20,
doctors
30,
all day
40
long.
doctors
Yeah.
a week, if not, like we train doctors all over the country. The vast majority are still doing single spin PRP. So if you're listening to this and you've done PRP and it didn't work, how much blood did they draw to you?
Mm-hmm.
Because most likely you did single spin PRP, which is no better than placebo. So you really didn't do PRP.
Right. All right. So now let's get into the fun stuff. Like let's talk about stem cells and exosomes and all the fun stuff.
Yeah, so you're talking about allograft material, which is made from donated human umbilical cord, amniotic fluid, amniotic membrane. Uh, Basically, this tissue is all sourced from females that donate the tissue during C-sections.
Yep.
And a common question I get asked is it safe? Well, the same rules that regulate blood donation and organ donation also regulate allograft donation. So these people are vigorously pre-screened,
Mm-hmm.
and then once that tissue is acquired, the product is also post-screened for all known communicable diseases, viruses, things like that. I know the tissue we use here at Buckeye. We also don't use tissue where people have been vaccinated for the COVID vaccine.
Mm-hmm.
For some people, that's really important because the spike protein from the vaccine would make it to the birth tissue. So we don't use anything that's been vaccinated with the COVID vaccine for our injections here. And you can make some really cool products out of these birth tissues. The one thing you hear stem cells, but really for arthritis and chronic injuries that won't heal or post surgery, just using extract from the umbilical cord is very valuable.
Mm-hmm.
And when you look at the umbilical cord, basically what happens is there's an epithelium around the outside of it, and then in the middle you have this thing called the Wharton's jelly, and that Wharton's jelly is really one of the main things that provides nutrition and stem cells for the baby. You're actually able to capture that and use it on adults, which is amazing. And I always tell people when you're trying to decide between like a PR, when would you use a double spin PRP as compared to when would you use an umbilical cord extract? What you have to keep in mind is as good as double spin PRP is, the older you get, the weaker your platelets are. So, once you get into your 40s, 50s, 60s, and beyond, that double spin PRP is nowhere near as effective as an umbilical cord because you're talking about day zero cells compared to theoretically 40, 50, 60-year-old cells
Mm-hmm.
that are producing these products. Um, the Warts jelly is kind of like fertilizer again, though.
Right.
So that's the same thing. You're putting fertilizer in an area to help it heal quicker. But we've seen amazing results. Even people in their 90s, when you use umbilical cord extracts and to treat an area that's not healing, they heal like a young person again. Well, why is that? Well, because you're putting the cells and the proteins from that umbilical cord into an area and giving the body a chance to heal.
Right.
Another common product you hear about are exosomes.
Mm-hmm.
And basically, just to be clear, what exosomes are and the way they're manufactured is you take the stem cells that are in the umbilical cord, or they're really called mesenchymal stem cells or signaling cells, and they put them in a petri dish and feed them in it, and it's the vesicles or the proteins that those spit out. Those are also very powerful. Some doctors really seem to like exosomes. Some people like umbilical cord extract. Which one's better? It's personal preference. I've seen really good results with both.
Mm-hmm.
I do think it's important to realize, though, that with umbilical cord extract, not only are you getting billions of exosomes are already in that, but you're also getting the stem cells, the long chain hyaluronic acid, lots of other things. So at Buckeye, we tend to lean toward using the umbilical cord extract for our orthopedic conditions. I think if you're doing a med spa type of situation or something topical, the exosomes, because they're so small in size, that would make more sense.
Mm-hmm.
But I think for for joints and for tissue healing, I prefer the Wharton's jelly extract.
Right. And then we also have some providers that like to use the exosomes via nasal due to exosomes past the blood brain barrier. You want to talk about that a little bit?
Yeah. So we have quite a few providers that are using exosomes for neurodegenerative type conditions, autism, different things, because as you said, the exosomes are so small in size that they're able to bypass the blood-brain barrier. So they use an intranasal application, which is kind of like a nasal spray,
Yep.
obviously more complicated than that, and get really amazing results, taking down neuroinflammation, providing nutrition for the brain. Very effective for any of those
Which
type of conditions.
brain health is
Post
so
stroke.
important nowadays. Like it's extremely important. So I'm really big on brain health. It scares me to think of ever getting like dementia. Like I get really scared about that. So I feel like brain health, everyone has inflammation in the body these days because of toxins, the world that we live in, food. And so I always preach to everybody that I talk to on the phone that me personally, yes, I want inflammation out of the body, but more so, I don't want any inflammation in the brain.
Right.
So,
Well, what they're finding with these recent studies, especially like Parkinson's and Alzheimer's, is there's definitely a huge connection between neuroinflammation and mitochondrial dysfunction and all these degenerative type conditions. And you have to realize these are things that you can treat with exosomes, with NAD. These different things will improve mitochondrial health, take down inflammation. So I always say with neurodegeneration, you can't reverse neurodegeneration, unfortunately, but I've seen it stop in its progression with treatment.
mhm,
So, the key thing, if you have Parkinson's or early onset Alzheimer's, don't just think it's a death sentence or there's nothing you can do about it. And I always tell people, I love traditional medicine, but what you have to look at is if the traditional medicine outcome is not good, that's when you really have to start looking at these alternatives. And traditional medicine, when it comes to neurodegeneration, really has no good solutions.
right.
That's when you should look back at functional medicine, peptides, exosomes, these allografts, because we've seen amazing results with those cases
Hmm.
that otherwise would just go down this really bad path of an inevitability of being debilitated.
Right. I agree. Okay, cool. And so, what are Muse cells? I know you said you were going to talk about that because a lot of people have heard of exosomes, they've heard of stem cells.
Mhm.
So, what's a Muse cell?
Yeah, Muse cells in the umbilical cord, that in that Wharton's jelly we're talking about, that has the highest concentration of mesenchymal stem cells, which for orthopedic use are the cells you want. Because there's lots of different types of stem cells. There's hematopoietic stem cells, which are blood stem cells. But these MSCs are really what you need to heal tissue.
Mhm.
And that's why a lot of people will use bone marrow to treat orthopedic conditions, which really doesn't make a lot of sense because the bone marrow and the stem cells they're getting from bone marrow has a ton of hematopoietic stem cells, which are blood stem cells. So if you had blood cancer, you wouldn't want MSCs, you want bone marrow or the hematopoietic. But by the same term, if you're trying to treat a joint, it makes no sense to use bone marrow because it's the wrong stem cell type.
Okay.
So, but of those MSCs, 1% about of those are these cells called Muse cells. And I want you to think of those as like a Superman MSC. They're very strong, they're very robust, and they're also pluripotent, which means they have the ability to not only engraft, but to basically turn into other cell types.
Hmm.
And the other beauty of it is they don't have the ability to turn into cancer cells or teratomas or anything else. So that's like a new thing in stem cell technology that's definitely become a hot word. I know a bunch of the biohackers and celebrities are doing Muse cells now. And the reason why is they're going to be just a much stronger MSC that has a much better ability to survive and thrive once used in procedures.
Okay. And can you use like these stem cells, exosomes, Muse cells, just for everything across the board? You can do it with your aesthetics, your hair, sexual health, uh, topical injection, joint tendons, tears, all the goods.
Yeah. If you're using microneedling, I think you're going to need to stay with exosomes. I
Hmm.
think when you get to Muse cells or MSCs, those would have to be injected. You can't just put them on topically and they're going to go through the skin, where the exosomes would with some type of like a derma roller or something like that. Um, so once again, kind of going back to when would you use an exosome, when would you use an MSC, when would you use a Muse cell? Um, if you're trying to get past the blood-brain barrier, intranasal exosomes makes a lot of sense. If you're doing some type of topical treatment where you're just microneedling, I think exosomes make a tremendous amount of sense. But if you're doing injections or IVs, that's when the mu cells and MSCs make more sense. You're going to get a lot more bang for your buck.
Okay. And some common questions that we always get here is, you know, especially I want to talk about now, like from a marketing standpoint, because a lot of people will come to us and say, oh, I want to go with this product because they have 100 million cells. And so I want you to talk about for a minute just live stem cells and really what the cap is on that versus, dead cells. When people talk about 100 million this and that, because I think that's a big deal to people, especially for people out there going to different clinics to get treatment and they decide, no, I can't go with you because they over here are offering me 200 million cells.
Yeah, more is not always better,
Right.
for sure. And I think, what we've known from doing thousands and thousands of IVs is really the cap on what you want to do is about 40 million cells. And the reason you say 40 million is once you get above that 40 million mark, there's a really strong chance of you having an innate immune response to those cells, which is
Hmm.
basically flu-like symptoms.
Yep.
So when someone comes to me and says they've been to Colombia or somewhere and had 100 million or 200 million cells, there's no way those were live cells because if you had that many cells that were live, you would be sick in bed probably for a couple days.
Yep.
So, really that 40 million mark is about right for a normal, adult. Obviously, for children, they would need less because it's going to be weight dependent, especially once you get below 100 pounds. But with a live cell product, 40 million is about the max you want to do in a single sitting for sure.
Okay. And also, a question I got yesterday is, people think they have to travel outside of the country to get these services, but that's not true.
Right. So there's, just to be clear, all these things we're talking about, PRP, A2M, exosomes, mu cells, MSCs, none of these are FDA approved. Doesn't mean they're illegal, but they're not FDA approved, just like vitamins and peptides aren't approved. So when something's not FDA approved as a provider, they can't make claims. So I can't say, hey, we're going to use mu cells or exosomes to grow your hair
Right.
or to cure your arthritis or A2M to cure your arthritis, even though it is stopping at the molecular level. I can't make that claim, and neither can the provider because it's not FDA approved. It never will be FDA approved. They're naturally occurring, they're not drugs. So if you're going to wait for FDA approval, it's just never going to happen.
Right.
But the good news is they work.
Mm-hmm.
So a lot of these people offshore, they can say or do whatever they want. And really what they have to watch out for in the US is the Federal Trade Commission, because they'll get you for false advertising if you make claims. But if you're based out of Colombia or Mexico or Panama, you don't have those concerns. So they're
Got
allowed
it.
to make these really broad claims and ultra high stem cell counts, even though there's no way that's true. And there's no regulatory oversight. So a lot of people are kind of suckered into, oh man, I'm going to go to Colombia because they said they can cure my MS or they'll cure my arthritis. So they'll give me 100 million cells. At the end of the day, US biotech's still the best. We have the best testing. They're coming, and I will tell you the process of the donated tissue in the US is heavily regulated by the FDA. So any procedure you get done in the USA is going to be much safer than going offshore, in my opinion.
Got it. And I know this is going to be a question that everyone asks is, and I know we talked about this before, is why, well, number one, does insurance cover this? And why not? Because we know that insurance doesn't cover it. And I always tell people the same thing of how does insurance work?
Yeah, all insurance works the same way. I always, when patients ask, well, if it's so good, why wasn't it covered? And I'll say, well, you know, all insurance works the same way. Like everyone, you're supposed to have auto insurance, right? And they'll say, yeah, okay. So when you have auto insurance, when your tires go bald, do you call Allstate and say I need a new set of tires? Of course not, because it's not catastrophic in nature.
Right.
But if you hit a tree because your tires are bald, then you can call Allstate and say, hey, I crashed and hit a tree, fix my car. That's
Mm-hmm.
more catastrophic in nature. Health insurance works the same way. It doesn't cover anything that is, going to be more maintenance or more preventative, but it will cover when you need the knee replacement, and it will cover when you have a heart attack or a stroke or all these other type of things. But it does not cover anything that's going to be preventative in nature.
Right. Yeah. And, I always tell people you don't want these, in my personal opinion, I don't want them covered by insurance because that's a whole rabbit hole we could go down, but I just wouldn't want it to be. right? Because then you get into this whole
I'd probably
big
save the
thing.
government a lot of money, but it's just never going to happen.
Yeah, exactly. Is there anything else that you want to talk about regarding these treatments or
I mean,
A2M, PRP?
I guess the main thing I'd like to get across is just because you went to one doctor and they said you're bone on bone or you have to have a joint replacement, more likely than not, there's a better than a 50% chance that's not the case
Right.
from what I've seen. It's
Yep.
probably more like 80% chance.
Hmm.
Obviously, we can't help 100% of the people, but always get a second opinion from someone who has experience in regenerative medicine. And experience does count. If I was vetting a clinic I was going to go to, how long have you been doing orthobiologics? How many procedures have you done? You don't want to go to someone who's been doing it for 6 months, in my opinion. We've been doing it for 10 plus years here. We've done thousands and thousands of cases. There's lots of other physicians that have lots of experience too. Find someone who's had a lot of different experience. Do they use all the tools in the tool bank? If they just do stem cells and don't do A2M or PRP, that's a red flag to me too. Are they using peptides? Like all of these things in combination are where you get the best results.
Hmm.
So if someone just does PRP, just does stem cells, just does peptides, that'd be like going to a mechanic that just has a wrench. Like you want the mechanic that has a screwdriver, the socket set. I'm not a good mechanic, by the way, but it has a full toolbox because every case requires different tools.
Right. Yeah. No, I love that. So, I mean, I feel like the future of healing is changing, it's evolving. And I always tell people I'm going to be 38 years old, February 1st. And what I want to do is I want to have a life full of like good health, longevity. Like I want to be able to move like I'm still moving, walk, get around. I mean, Buzz's mom is 80 years old and she goes up and down our steps every single day, like 10, 12 times, 14 times a day. She's in great shape. And so that's what this is to me. Like that's what I'm wanting to do. I want to be 80 and be running around still.
That's what they call your health span. I mean,
Yeah.
who cares how many you have lifespan is how long you live, and then you have your health span is how long do you live healthy.
Right.
And what's the sense of having a lifespan of 90 years when the last 20 years of your life you're in a wheelchair, you can't get around.
Right.
So really it's all about how long am I going to be able to, and really movement is life.
Yeah, it is.
You got to keep moving.
Yep.
And if you don't maintain your joints and sooner or later, probably most people would need A2M at some point or some stem cells to keep the joints going. It's kind of like a car. We have a 67 Camaro at home that's probably nicer than all of our cars, but it requires maintenance.
Mhm.
If that 67 Camaro had never had new ball joints on it or a new engine put in it, it'd be a piece of junk at this point.
Right.
So if you don't want your body to be a piece of junk, just realize, and it all starts off with pain. If you have pain somewhere, that's your body warning you there's a problem.
Mm.
And if you do steroid injections, anti-inflammatories, take pain medications, that does nothing to fix the problem.
Right.
That's putting duct tape over the check engine light, and you're just going to wreck it. So as soon as your body has pain and it lasts for a couple weeks, there's a problem there. Go see someone that does regenerative medicine, uses peptides, uses orthobiologics, and see what you can do to help your body heal itself. Because once again, if you're alive, you have the ability to heal as long as you don't wait too long.
Yep.
It's that simple.
All right. Well, if you're listening to this episode and you're like, that's me, or I have more questions, you can just drop us a comment or reach out to us, and we'd be more than happy to answer all of your questions because we love regenerative medicine. It is the way of the future.
It works.
Yes, it does. All right. Dr. Buzz, thank you so much for finally showing up. We appreciate it, and we'll see you on the next show.